Hello, welcome to Qatar Biobank Showcase educational series organized by the National 100K Plus Cohorts Consortium. I would like to thank the organizers for giving us the opportunity to present the journey of Qatar Biobank from conceptual until today. I'm excited to take you through our journey, share with you our strategy, and hopefully share some tools we've used to help you plan or develop your biobanking strategy. I'm very happy to answer your questions at the end. And if there is anything not covered, please consider signing up to the remaining Qatar Biobank webinars over the next week. And if we still haven't covered it, you are very welcome to reach out to us directly. Before I start my presentation, I have nothing to declare related to this presentation. The objectives of my talk today is to provide you with the tools to design your biobanking strategy, identify the key stakeholders, and design your operational plan. These are the tools that we've used to develop our biobank. So I will start with a brief introduction about biobanks, and then I will take you through on how to manage a human biobank, how to design an operation resilience plans by sharing Qatar biobank experience. So let me take you on a journey. Qatar is a small country, the Arabian Peninsula. You may have heard Qatar recently because we have hosted the FIFA World Cup 2022. Some of you, you may have visited us during this time. Qatar has a population of 2.7 million and around 88% are expats. So let me share with you a little bit about Qatar Biobank. We've been established in 2012 and supported by the Qatar Foundation, the Ministry of Public Health, Hamad Medical Corporation, which are the general hospital here in Qatar, and guided by the Imperial College of London. Qatar Biobank is a unique resource in the region. We are a standalone biobank that hosts many studies. And what I mean about that is that we are not under any academia or hospital environment. Our biobank houses our recruitment and registration team, our clinical and data collection facilities, our laboratories, our medical review team, research access office, and IT resources, all under one roof. So who we are a member of Qatar Foundation, and we are acting as the National Center for Biological Samples and Information in Qatar. And what we do, we see ourselves as a scientific partnership between the research community and the people here in Qatar to build together a better, healthier future for the next generation. We design and we implement studies that allow for the collection, processing, and storage of biological samples and associated data for research. So let me give you like a short introduction about biobank industry. So biobanks are facilities for the systematic collection and storage of high-quality biological samples and their associated data in a structured and analyzable manner under an ethical and legal framework. There are different types of biobanks depending on the type of the sample they store, the aim of the collection they have, or the type of the organization they belong to. In this talk, we will concentrate on the human biobanks that, according to the type of the population they recruit, are divided into the population-based, recruiting subjects from the general population, disease-based, recruiting patients for specific diseases, and clinical-based, recruiting general patients from the healthcare system. So let's look at some of the basic requirements when setting up your biobank. Key components are like puzzle pieces that link together to make the biobank. Starting from your identified target population, the ethical, legal, and social implications, including the institutional review board and informed consent form. We will talk more about this in our final webinar about biobanking services. Another important component is the data and specimen required for the collection strategy. Infrastructure is the heartbeat of your biobank and allows departments to communicate. So this will be covered in greater details in IT webinar. Analytical platforms such as different omic data are invaluable resource to supplement biological and associated clinical data. Identifying appropriate areas for application for the collected data and samples impacts the effectiveness of the biobank. Building a biobank is not an easy process, but with a careful design focus on identifying clear, feasible requirements, you can create a valuable resource for research. Here are listed some of the requirements that you might need to consider while you are planning your biobanking strategy. So where to start? You can start for planning for sustainability. Sustainable biobanking is not straightforward, and it depends on the factors that impact your biobank. It requires a balance among the social, financial, and operational factors, connected to relationship overlap, and identify areas of challenge. There are 9 recommendations that we followed, and these are to develop our business plan, follow a user-centered approach, identify and show our value, select the business model, track and control the cost, find multiple funding sources, engage our stakeholders, become an attractive partner, and ensure that the samples and the data are reused. Now that we've talked about some general requirements, I would take you through Qatar Biobank's experience. So we set our ambitions and strategies in a business plan. We gather the support of the different stakeholders, identify and tackle obstacles, challenges, and structure the organization and its finances appropriately. In our business plan, we involve key stakeholders and external collaborators. We followed a continuous cycle of planning, implementation, assessment, and improvement. Our mission is to act as Qatar National Center for Biological Samples and Information to enable research. And our vision is to be a research enterprise platform to deliver personalized healthcare. Our strategic objectives are to sustain a biobank as a fully operational organization, internationally recognized for excellence, to create a biobank with sufficient numbers of participants contributing to high-quality data and biological samples for research, and to provide the region's most advanced biobank collection. On the right side, you will see that against each specific objective, we identify different initiatives. Our organizational structure includes the director and 6 different departments, the clinic and lab, the IT, the Research Access Office, Scientific and Education Department, the Medical Review Office, and the Communication and Booking Department. And we have the Institutional Review Board and the Scientific Access Committee that support our services, and their function will be covered in greater details in Biobanking Services webinar next week. We use a SWOT analysis to identify our strengths and weaknesses, opportunities and threats. Our main strengths were the vision and strategic plan supporting Qatar Biobank from higher authorities in a national level, the support of the main stakeholders, the centralized healthcare system, access to state-of-the-art infrastructure, and of course access to the Arab population. But this is our unique selling point. Of course, we had to identify our weakness, that was mainly the small population size. We identify opportunities such as we are unique in our field and we could fill the gap in the market. The major threats identified were the education of or the awareness of the population, as they were not exposed before to the idea of a biobank, as well as we are relying heavily on the recruitment of participants. Therefore, bad publicity relating to biobanking may have a tremendous effect in our operation. Next tool we used was to perform a stakeholder analysis to identify, segment, and prioritize our stakeholders. We worked on strategies to engage our stakeholders tailored made to fit to their needs. The stakeholder analysis was used also as an input to our Biobank's business plan, business model, and value proposition. So this is a list of the potential stakeholders. This is our stakeholder analysis, identifying participants, funding agencies, mainly here in Qatar, research institutions, academia, governmental bodies, and healthcare providers. Of course, the key to success is the satisfaction of the key stakeholders. Next tool we used is to identify the business model that fits better to us. It is important to mention that the business model is a value-based and not cost-based, and it is also important to decide carefully what business model fits to your biobank based on your own needs, your target stakeholders, available resources, and anticipated impact. At Qatar Biobank, we adapted the cost recovery model, donation-based model, and contract research model. So at Qatar Biobank, we charge users for services or access to samples and data. We are heavily dependent on public sources of funds, and also we are focused on established contracts with research institutes, pharma, and biotechnology companies. We also follow a user-centered approach. Our priorities are stakeholders. We have established an easy-to-use, standardized, and transparent procedures. We get continuous feedback from our stakeholders, either using surveys or focus groups. And we are trying to clearly communicate the right value proposition to the right stakeholders. So let me explain what a value proposition is. It is the aggregation of benefits a biobank offers to each of the stakeholder group in exchange for a certain cost. As an example, at Qatar Biobank, we have identified that the value proposition of our participants are our stakeholders, is the medical health feedback. So as the benefits increases, and the costs are removed, the motivation also increases. So by investing as a biobank into this value for our participants, we have managed not only to recruit participants in a preferable rate, but to have a waiting list of participants that they want to be enrolled in different studies we perform. It is important to us to provide proof of our value, for example, by tracking performance indicators and impact analysis. Some of the different value categories related to the participant samples, data, services, and so on are the overall value of our biobank and your biobank. It is important to emphasize the indirect value, such as the generation of knowledge, and communicate that. Here is a graph showing our growth strategy in time, the different initiatives, and the different participant numbers. We started back in 2012 running a pilot study validating our tools like the questionnaires, clinical assessment, sample collection, processing and storage, as well as our IT infrastructure that our team will cover this in the next week. Till we reached to the ramp-up phase, recruiting 36 participants per day. The initiatives were designed and implemented based on the needs of our researchers and stakeholders. So as you can see from QBB initiatives, we have started working with the Ministry of Public Health on building and setting up a tissue biobank. We link with the electronic medical records. We are main providers of the Qatar Genome Project, and also because we are revising and our study protocols and we collect the requirements from our stakeholders, there was a need of collecting data, MRI data for brain and whole body. So we started this at 2018. We have started working on cubic birth cohort study in COVID-19 biorepository. So I will show you the studies that we perform at Qatar Biobank. At Qatar Biobank, we perform different studies. The main cohort studies are the population-based cohort study, aiming to recruit 60,000 participants, adults, Qataris, or people that they live in Qatar for 15 years or more. This is based on an agnostic hypothesis, and the protocol is designed to fit for purpose for the latest sophisticated analytical platforms. In this study, we follow the participants every 5 years. The second collection is the Qatar birth cohort study, aiming to assess the synergetic role of environmental exposure and genetic susceptibility in the development of chronic diseases at early childhood. In this study, we aim to recruit 3,000 triads, the pregnant women, their husbands, and their children in different time points, following them up in different time points. Also, back in 2020, during COVID-19 outbreak in Qatar, the Qatar Scientific Reference and Research Task Force selected Qatar Biobank to be the key institution to manage the design and the setup of COVID-19 biorepository, aiming to deliver high-quality samples and data to support research around COVID-19. In this study, we recruited participants infected with COVID-19, and we follow up them during their disease period weekly and monthly after recovery for a year. We have also recruited participants before their vaccination against COVID-19 and follow them up for a year. Also, Qatar Biobank hosts the leftover samples from the National Virology Lab here in Qatar. Let me give you an overview of the visit in our facilities. Once potential participants come in our building, they are registered with us, and once they are consent, we start the collection of data through different questionnaires and clinical assessments such as anthropometric measurements, blood pressure, spirometry, ECG, treadmill test. Also, we are collecting imaging data such as retina images, 3D, carotid ultrasounds, IDEXA, and we assess also eligible participants for MRI visit. At MRI visit, we run brain and whole body MRI. We are collecting data via corneal confocal microscopy and vibration sensory test, as well as we run cognition functional tests for attention, psychomotor speed, executive function, and episodic memory. We are also collecting different types of biological samples such as saliva, urine, and blood. From blood, we are isolating viable cells, serum, plasma, buffy coat, red blood cells, DNA, and RNA. Our lab is fully equipped using robotic system for high throughput analysis. Please join our lab webinar to see for more details. It is important to mention that our IT infrastructure and the data warehouse linking the samples with the collected data, this will be covered in more details by our IT team next week. In summary, Qatar Biobank offers services, specimen data for researchers, and information for policymakers to develop evidence-based policies. We serve the Qatari population. Our participants are very happy to contribute to research as well as receiving their health feedback from our medical review office. Also, we are giving back to the community by acting as a screening clinic as we refer participants diagnosed with different types of diseases back to the healthcare system. Also by providing reports to different authorities related to the prevalence of diseases in our population. Main stakeholders are the researchers, students, pharma and academia, hospitals and other research entities that we provide to them access to our data and samples. Biobanks are an asset to support precision health in different levels, as the deep longitudinal profiling can provide evidences to assess disease risk at an individual level, detect early preclinical conditions, and initiate preventing strategies. We see ourselves as one of the main pillars in Qatar's precision health initiatives by providing a deep longitudinal phenotypic profiling of our participants that can lead to actionable health discoveries and provide relevant information for precision health. Now let me take you through the challenges but also the opportunities that we have faced over the years. A biobank in general can face challenges in different levels, such as in financial, operational, and social dimension. Business continuity is a challenge, and this is mainly related to the high cost related to the manpower, equipment, specimen handling, and others. A way to overcome this is by preparing a strategic framework, including sources for funds such as research grants or adopt a cost recovery business model. At operational level, a big challenge is to ensure the optimal utilization of your biorepository. Campaigns to promote and facilitate utilization of data and samples might help. And in the social level, one of the main challenges is accountability, both to the participants as well as to your funders. Here are the sustainability metrics for monitoring your biobank's deliverables is important, as well as to show how your biobank is complying with the ethical guidelines and policies. For us in Qatar Biobank, and more specific challenges we encounter in the Qatar Biobank population-based cohort study, where the long informed consent, the long format of the informed consent form, this is to comply with the Ministry of Public Health guidelines here in Qatar, where we have to develop a summary to highlight the main points to the participant at the end of the informed consent form. Incidental findings are a major challenge in a biobank, and what we did, we have agreements in place between us and the healthcare providers for referrals or for interpretation, let's say, of the MRI imaging to be provided by certified diagnostic centers. We face also other challenges that my colleagues will cover in the next webinars. But let me introduce you to our biggest challenge we faced and also show you how the tools that we had in place help us to adapt in a new reality. Let me recap about our scope, applicability, and operation. So Qatar Biobank established to serve as the country's national center, providing adequate health information and biological samples to enable research, particularly in the field of precision health. Our core business includes the population-based cohort study that is our main source of data and specimens. We also provide services to the research community by allowing them to set up and implement nested studies using our research infrastructure, and our main aim is to support personalized health initiatives in Qatar. We regularly visit and review our operational plan to meet the requirements of our stakeholders. We are trying to meet the expectations of our community by providing incentives, personal, such as medical screening, or general, such as research outcomes, and we are building a relationship with third parties such as suppliers. Apart from our experience, we have established through the years a wide network of collaborators, as shown in the figure, in the health, governmental, and academic sectors. So here we are working against our different initiatives, focused on achieving our goals, and 2020 and COVID era comes. The COVID-19 pandemic has been a test of the level of responsiveness and preparedness in different fields, including efficient and effective biobanking operation worldwide. We had to transform our operations. And because a picture is worth 1,000 words, in this slide I just wanted to show to you how much we had to transform. In the left picture is Qatar Biobank staff collecting data during our usual operation in our facilities, and in the right side shows Qatar Biobank staff collecting data for COVID-19 repository project. In a short time, not more than 5 weeks, at Qatar Biobank we transformed our operations to accommodate the COVID-19 biorepository. Our staff had to be moved from our facilities and be allocated to the COVID-19 hospitals to recruit patients. I need to mention here that it's a big accomplishment for our team under such difficult circumstances to be flexible, to overcome all fears, personal resistances related to COVID-19 infection at that time, that we didn't have enough information. Of course, a big part played all the trainings in place and the heavy, focused and highly matured function in Qatar Biobank culture related to the health and safety practices that build the trust between the personnel and the QBB management. So we achieved to recruit like 2,000 participants within 4 months following the high standards of Qatar Biobank, achieving the collection of harmonized phenotypic data and the standardized collection, processing, and storage of biological samples. That these are requirements for the rapid generation of meaningful evidences to improve the management of COVID-19 or to support the research around COVID-19. I need to mention here that an important asset of our Qatar Biobank is the IT department that developed customized solutions for data collection and specimen traceability. So in this slide, you may see the main challenges and risks we faced together with the opportunities during our transition period. The main challenge was the continuity of our operation, together with the disruption of the supply chain and the new reality of working remotely. So by putting in place trainings for the safety of our personnel, developing in-house solutions for the delivery of data to the researchers, and by linking with the country's central supplies, we were able to overcome all these challenges, modify our operations, and going out from this crisis stronger. So COVID-19 pandemic has been a test of the level of responsiveness and preparedness, and due to the mature business continuity and risk management plan and the implementation of appropriate tools and our network with other stakeholders, we managed to create a robust framework for an effective pandemic response. The different biobanking tools that are in place here at Qatar Biobank help us to cope with the drastic changes that we faced at the time of COVID-19 outbreak, and also to continue our usual business as possible. These tools are part of a general framework that constitutes the Qatar Biobank operational resilience plans, as you can see in the figure on your right side. The organizational plans such as the business plan and the business continuity plan, the best practices and guidelines such as CISBER best practices for biobanking, the standards such as ISO and CAP, ISO standards and CAP that are requirements and opportunities to demonstrate competence, And the targeted tools like the training, certification, qualifications, and so on, all of them aim to provide high quality and fitness for purpose of our biobanking services. Here are the different standards we are certified with: quality management system, information security management systems, and biotechnology and biobanking. For ISO standards. We are also CAPA accredited for human specimen, and we are following ISBER best practices. It is important to decide the good practices for the sustainability that you will follow to be beneficial considering your own status as a biobank. The Economist had a publication on how science goes wrong, reporting that half of the published research cannot be replicated. Nature Survey showed that scientists agree that there is a reproducibility crisis. Replicating a study is an important way to ensure that there is a universal accuracy of a scientific claim. And access to structured, standardized, high-quality data or samples is a way to ensure reproducibility in research. Remember, biobanking is all about trust. Thank you for your attention. My colleague Wilma Lobo will take you through accreditation journey. Wilma, the floor is yours.